Hi, I hope you're all well. My name is Sussy Ann Miriti. I'm in the School of Public Health in the Department of Nutrition and Dietetics. So today I'll be taking us through Nutrition Education and Counselling, which is BND 4201. And to start with the introduction, I'll put us to light on what is nutrition education. And nutrition education is the process by which people are able to gain knowledge, attitudes, confidence and skills that are necessary for developing good dietary habits. Good dietary habits, in this case, you are talking about ways in which somebody is able to choose foods. They are guided well in terms of their consumption, and this gives an ideal nutritional status, which also translates to good health. Nutrition counseling is defined as the process of identifying and labeling a nutrition problem, and then you have a well-planned discussion towards solving the nutrition related problem. Now, in this both, we are talking about a process, which means nutrition education and counseling is not a one-off kind of an event, but it is a series of events that are geared towards having proper food intake and towards having proper dietary habits that translates to the good nutritional status. So we have populations that are usually at risk of health and nutritional problems, and these populations are predisposed to vulnerability because of a variety of problems, one of which is you find that they have inadequate access to food, and in this case we can talk about food insecurity. They are not secure in terms of assessing this particular food. On the other hand, even if they have the food, there is inadequate intake, and if they are not taking food sufficiently and in the required amounts, then this also predisposes them to nutritional problems. So we have a variety of categories that we can talk of as vulnerable, where we have the infants and the young children, we have the pregnant and the lactating women, we have the elderly, we have the refugees, the homeless and the displaced, and then we have the sick irrespective of age. Anybody who is ailing might have issues around having poor appetite, and also there might be issues in absorption of the food, and this now predisposes them to poor health. Now, because we have done the other populations, we have looked at infant and young children, we have looked at the pregnant and the lactating women. So today we will go through elderly and how we are actually able to take the elderly through a successful counseling session. So we start by understanding what is geriatrics nutrition. Geriatrics nutrition, when you talk about the old age or the people who have advanced in age, we can also call them the elderly, we can call them the aged, or we can call them the geriatrics. And in this, we are talking about a generation that has achieved 65 years of age and above. How are you able to obtain proper nutrition in this particular category of the population? The reasons that make the elderly being referred to as the vulnerable is one, they have actually they have loss of abilities. You find most of them, because of the advancement in age, they have lost loss of, they cannot hear well, some cannot see well, they are limited in terms of movement, they cannot be able to achieve much in terms of sustenance, and therefore they are wholly dependent on others. So they have the loss of independence, where some are wholly dependent on somebody else for everything, including their food intake, where someone has to feed them or someone has to prepare the food for them because they are not able to do it on their own. And also we have so many challenges of health conditions in this particular group. With the diminished immune system, you find that they have so many conditions that they suffer from, conditions ranging from diabetes, they have a problem in food absorption, absorption, they have problems related diabetes, they have problems related arthritis, osteoporosis, and so many other problems that make it difficult for them to be able to consume food ideally as they are supposed to do. So in this case, you find that we have the nutrition problems and risk factors that are associated with this particular group, and we categorize them into three. We have the psychosocial factors. You find that this particular category, either they have lost a loved one or a partner that they were depending on, or you find they are all on their own. They are very lonely. So loneliness is one of the problems. And sometimes they are neglected. They have nobody to take care of them. They have been left on their own. And with the loss of abilities, then it becomes very difficult for them to be able to achieve their nutritional state. On the other hand, they may have, be having economic factors where you find that most of them are actually retired. They are not in active jobs, so that means financial constraints, and if they have not been able to save properly, then that means they are prone to poverty, and that now predisposes them in terms of getting sufficient food and getting sufficient nutrition in terms of their intake. Then we also have physiological factors. This is where they have lost most of their abilities, body abilities, in terms of how are they taking food, and if they are able to consume this food, how is it absorbed. You find their metabolism is constrained, they are suffering constipation and all that, and that interferes with their nutrition intake. We have some points to note when we are counseling the elderly that you need to have at the back of your mind. One thing is that growth has ceased. Now in this case they are no longer growing, but what they need the nutrition for is for maintenance as well as repairing tissues and cells, and therefore the food that they are taking in should be sufficient to be able to provide for that. We also have special nutritional requirements for this category of the population, where they may be affected by diseases, and these diseases might dictate what they have to take. The loss of abilities, they cannot be able to go fend for their food, and all these usually have to be considered when you're trying to get an intervention for this particular group. You also find that following a healthy diet is also important for this category, where a healthy diet means they need to consume a balanced diet that is sufficient in the nutrients that they require. They need sufficient adequate food to meet the recommended dietary allowances. At the other time, you also need to check on moderation and the variety of food. Then we also encourage physical activity in this particular category so that they are not sedated because of all the benefits that we know physical activity give. And then we also need to understand that aging is gradual and it is also a continuous process. So as it creeps in slowly, you find some will lose weight, others will gain weight, some will lose appetite, and then we have so many other conditions coming in. So we have to be careful through the process so that you treat each as an individual and you take care of the individual needs for each of the elderly. So we have pointers to a healthy diet for the elderly when you're making an intervention for this particular group. And things can mean you offer more frequent meals where you don't give one big meal at a time. They may not be able to take it in, and that can also lead to loss of appetite. So you offer small but frequent meals. At the same time, explore nutrition support clubs. You find we may have programs that are geared towards helping the elderly take advantage of such programs, as well as if they can be in company of the others so that they are not eating on their own, then that also becomes an advantage. You also need to keep a well-stocked food cupboard, and this is especially for the elderly who do not have anybody to take care of them, so that the food is within their reach, and whenever they need to eat, then they can be able to assess that particular food, and at the same time they are able to take care of such needs as they arise. The other point we need to note is we need to increase variety of foods for this category of population, whereby you pick different foods from the different food groups that we actually have, so that they have a variety. You can also consider offering raw foods, and especially the fruits and the vegetables, alongside the cooked foods, because of the benefits that we are able to get from such foods. Then you offer food preparation gadgets, and these especially in cases where they are constrained in terms of their capabilities or in terms of their abilities to prepare the food or to consume the food, where you find some of the elderly are immobile. So in that case, you actually need to aid them to prepare the food or aid them to consume the food. Then for those elderly who are literate, you can consider keeping a number of literate books, and this is especially for planning meals, where you can give them a food that they can refer to in, whenever they need to prepare a meal or make their meals, so that they have no difficulties in terms of achieving the required nutritional needs. So when it comes to the healthy diet, when we are making the overall diet for elderly, then we have to actually consider the recommended dietary allowances, and you also need to consider the various parameters of the various elderly, such that you can put their activity level. You find some can be able to be involved in a number of activities, whereas others are completely sedentary. So you actually need to put all this into perspective when you are making their diets. So on the counseling tips for the elderly, first of all, you need to determine if the client is capable of providing reliable data, because of the various issues related to the elderly, where some have mental breakdown, others are confused, others suffer dementia. So in all these cases, you actually need to determine if they can be able to give reliable information, and if that is not viable, then during the session you can consider bringing in a caregiver. You can also consider working closely with a relative or a friend who can be able to pass the information or to give the service then to the elderly. Then you also need to make the effort to communicate clearly. These are people that have loss of abilities, sometimes cannot hear well, sometimes cannot see well, sometimes cannot concentrate for long hours. So you have to put all this in consideration when you're communicating to them, so that you talk with a lot of clarity and you are very clear in passing the information so that it is useful. On the other hand, you need to inquire about the client's use of nutritional supplements and special diets. You actually need to know, are they on any other special diet? Are they using other supplements to be able to take care of their nutritional needs, such that when you're doing the intervention, then you also put these into consideration and into perspective. On the other hand, if the client is resistant to change, you need to be very patient. Now, the elderly may be a very special category because of their advanced age. Sometimes they are prone to imagine they know some of these things, or they don't need to do some of these things. So you have to be very patient with them, be very clear, use clear language so that they are able to understand, and practice a lot of patience with this category. So for the nutrition counseling and the education session for the elderly, remember, one of the things you want to achieve is the good dietary habits, where they are able to consume their foods well, they are able to meet their body needs, and they are able to attain the required nutritional status. And that means it also translates to proper health, because there is a very strong link between the nutrition and the health of the individual. So in this case, we want to improve on their dietary intake. You need to ensure that they have good appetite. In this case, good appetite will translate to them taking sufficient amounts of food, and that means they are able to take in the right nutrients. So you also need to thoroughly guide them through a proper diet, where whatever they are consuming is whatever their body requires, depending on how the individual presents themselves. And in case of conditions that may require specialization in terms of their diet, then that also has to be put into perspective, so that when you're doing the intervention, then you're able to to consider that. So how do we guide them through the session? First and foremost, we need to put on the solar approach. The solar approach is where you organize your room in terms of comfortability for both the counselor and the counselee. Ensure that you're sitting squarely. On the other hand, you need an open space in between the two of you, and the open space gives sufficient room to express themselves and to be able to speak freely. Then you need to lean forward. Leaning forward is an indicator that you're actually listening attentively. And then you need to keep the eye contact. Eye contact is also a way to show that you're listening attentively to your client. And then the other thing you need to do is to relax. If at all you'll be able to achieve a good session, then you actually need to be comfortable, both the counselor and the counselee, so that the comfort now helps in achieving the objectives. So the first thing to do once you're comfortable then is to establish rapport with the client. How do we do that? For us to be able to achieve rapport with the client, once the client is in, ensure you greet them, create an environment that is relaxed for the both of you, welcome them in, smile at them, get to know them well. If you can, address them by name, makes them feel more confident, and establish a proper relationship for the both of you. So in this case, we have the two approaches that also can be used to be able to achieve this. We have the gather approach, and then we also have the Alidra approach that can be used in the session. So after establishing the rapport, then you assess the client. When you're doing your assessment, then you can carry out the nutritional assessment, whereby you can do the anthropometry. You're checking on their height, you're checking on their weight, you are carrying out the BMI. You can also take them through the biochemical tests. Of course, you may not have the capability of doing that, so if there is need, they are referred to the laboratory for such tests, and especially to a test for conditions like diabetes, or conditions like gastrointestinal issues. So they are sent to the lab, then they're able to come with the data that you can actually analyze. You also need to take them through dietary assessment, where you can look through the diet they have been consuming, and in this case you can do the 24-hour recall. So you use the data on yesterday, if it was an habitual day for them, how they consumed the food through the day, and through that analysis, then you can be able to give an ideal situation if what they are consuming is good. And then on the last on that is on the dietary assessment. You can also do the food frequencies, and look at how they have been feeding through the week. Can be 7 days, can be 14 days. And then you also need to do the clinical assessment. Clinical assessment is looking through the client through observation. You can actually be able to tell if the client is well or not. So in assessment, you also do the history, where you're taking the medical history. You also may need to take the family history. You also may need to understand the diet surrounding them. So with the assessment now, it puts you on the proper light to know the predisposing problem for this particular elderly and how now you are able to intervene in this case. Then after that, identify the key difficulties for this particular population, get to understand what is the basis of their problem, and especially in terms of food intake. So once you are doing, you have done the assessment, then this is actually easier to assess because you can be able to tell the actual problem, the actual reason why this particular client or this elderly person is not able to consume food as they are supposed to consume. And at this point now, you pass on the knowledge. You do the education to the client, where you explain to them the ideal situation, tell them what is the problem at hand, and then once they have an understanding, you also need to understand at this point, do not give so much information that it can confuse the client. You can give bits and bits of information, and because we said it is a process, it's not a one-off event, then you can consider giving the rest of the information at a later time. So give information that is useful at that particular time, and if there is additional information in terms of educating them, then you can do it at a later time. So education is very important because it puts the client on the light in regard to the problem at hand, so that now when you are doing the intervention, it is from a point of understanding. So you discuss the options that are viable, all the possible alternatives, and then, because it is a counseling session, you are not advising, or you are actually not giving a solution to the client. This is an active session where also the client is actively involved. So what you do is, once you educate them and you discuss through the possible alternatives and the possible solutions, then you also guide them and you also leave them to be able to make a decision on what is viable and what is most important in their case scenario. So in this case, you allow the client to make a decision or to decide, and then guide them depending on the decision that they have actually taken. So at this point also, you give relevant assignments, and for the case, the elderly, the kind of assignments you can give, you can actually tell the elderly to do an exercise that they can be able to follow up at a later time. So if they are able to do an exercise, if it is a recipe or if it is a menu, they can be able to recite. So you make sure you give some relevant assignment. If they are literate, then you can also give written materials that you can always refer to. And then after that, you ask the client to repeat the agreed doable action. So basically at this point, you actually give the client a chance to repeat the whole process. What have we agreed on? What are the changes they are going to make? What is it they will do for us to be able to achieve the objective at hand? So in that case, allow them to take you through the doable action or the agreed action or the possible actions, and then through that you can actually, as the counselor, you can be able to understand if they have understood the whole process. If there is any correction to be done, then you can actually do it at that particular point. If there is any point that needs clarification, then it can also be done at that point. Then at that point also, you need to update the counselor's notes. Of course, you need to keep records for the subsequent visits so that you're able to do references. And then you plan for the next appointment date. You actually need to agree together with the client on the timelines, because objectives actually need to be SMART, where they are time bound. And in this case, you need to do an appointment date when you feel at least they would have achieved a bit of the objectives that you have set together. And then after that, what you do is the follow-up. The follow-up is where you have to keep checking on the client, check the progress of the client. So the whole process is for the benefit of the client, and that has to be ensured, and therefore encourage them to come back until you are able to meet the objective that you actually want. Yeah, so that brings us to the end of this lecture. So next time we'll be continuing on the other at-risk populations, and therefore we'll be looking at the homeless, the refugees, and the displaced.
We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.